Okay, so welcome along everybody to this Winslow Health webinar in conjunction with the Barwon Health Foundation. My name is Francis Trainer and I'm the Philanthropy Manager with the Foundation, and I'm delighted to be your host this afternoon. Let's start by acknowledging the traditional owners of the land. We, the Barwon Health Foundation, acknowledge the traditional owners of the land, the Wadawurrung people of the Kulin Nation. We pay our respects to the elders both past and present. We thank the traditional owners for the custodianship of the land and celebrate the continuing culture of the Wadawurrung people, acknowledging the memory of honourable ancestors. We also welcome all Aboriginal and Torres Strait Islander people joining us for this webinar this afternoon. And a special welcome to everyone from Winslow Constructors, both joining us live for this webinar and also to those of you who are watching the replay at some point in the future. It's great to have you all on board. Winslow have been a great supporters of the Barwon Health Foundation and by extension Barwon Health, and their amazing support has gone a long way to ensuring the best care of patients at our health service. Not only are Winslow generously supporting their local health service, they obviously have great care for their staff to be conducting these health webinars, and I think that speaks volumes for the quality of the company and the people behind them. I'm delighted to have with us today some of the team members from the Barwon Health's Cardiology Clinical Trials team, and we're very pleased to welcome Anne Welsh, Donna Sorrigan and Susan Ryan. Welcome all, and thanks for joining us.
Thank you. Thanks for having us.
First off, the horrible stats. Now, heart disease has a tragic impact on Australian families, taking 48 lives every day. 620,000 Australians live with heart disease. Poor nutrition and more stressful lifestyles are contributing to an increase in heart health problems for many people today. In fact, coronary heart disease is the single leading cause of death in Australia, with someone dying from coronary artery disease every 27 minutes in our country, which is all quite frightening. Since its establishment in June 2000, under the direction of Associate Professor John A. Marina, a truly wonderful man, the Cardiology Research Unit has participated in numerous large-scale global clinical trials in cardiovascular disease and is recognised both nationally and internationally for conducting high-quality clinical research and exceeding expected recruitment goals. The Cardiology Research Unit specialises in investigations into the following therapeutic areas: heart failure, heart attack and unstable angina, high cholesterol, atrial fibrillation, atrial flutter, peripheral vascular disease, type 2 diabetes, high blood pressure, heart failure, obesity. The Cardiology Research Unit has been involved in the development of a number of new therapies, treatment and options and interventional procedures which have now become standard of care for patients with cardiovascular disease. And now some positive stats. Men who climb 50 stairs or walk 5 city blocks a day may lower their risk of heart attack by 25%. Men who sleep 7 to 8 hours a night have about 60% less risk of fatal heart attack than those who sleep 5 hours. Men live 11 years in poor health, most preventable by making small lifestyle changes. And there's no doubt the clinical trials play a large role in extending our lives. So welcome again, Anne, Donna and Susan. Now, for those of you listening in, there's a brand new Barwon Health Research and Clinical Trials website where we can find out that Anne owns a couple of pets, Maisie the Bitzer and Honey the Cocker Spaniel, and her signature dish is tarragon chicken. Donna is a proud owner of Bonnie the Golden Labrador, her signature dish being lasagna or roast lamb, followed by chocolate pudding. And Sue Ryan has cats, Carol and Eric, dogs Bruce, Macy and Tim, horses William, Audrey, Flirt and Robert, and a myriad of other named and unnamed farm animals. I also know that Anne is an excited cat supporter. Donna's bulldogs fell short this season, and whilst Sue has plenty of cats and dogs, it doesn't seem she has much time for the football variety. We haven't got a list of your star signs, favourite songs, or what famous people you'd invite to a dinner party, but I also know your favourite coffee order when you pop down to Son of an Elk or Cafe Go. And this is sort of information on the website right across the profiles of all our researchers at Barwon Health. Now, it may seem strange to include this sort of information, but amongst heavy information of clinical trials, but I must admit I like it as it personalises our researchers and takes away from that stereotype of the white lab coat and looking down one end of a microscope. And I'm sure clinical research is far more exciting than that. And of course, I do add all the serious bio information is there too. Now, first to you, Anne, yours is a very extensive background. Just tell us a little bit about that and how you came to be involved in cardiology research.
Thanks, Francis. Yeah, so I've spent almost all of my career here at Barwon Health, and predominantly the emergency department. I spent 20 years in the emergency department here at Barwon, and then went on to undergraduate education at Deakin and undergraduate nursing support here at Barwon Health, then graduate support. And a position became available here in the Cardiology Research Unit. And I was lucky enough to get that, and it was a job that was made just for me. I feel I love it in every way. I've always, enjoyed every part of my career, but this is absolutely thoroughly enjoyable. So very happy to be here.
That's good. And just to digress a moment from the subject matter of heart health, what also caught my eye on your bio is that you've also been working this year on the COVID-19 hotline and had a role in the really highly successful contract tracing team at Barwon Health. How have you found that role?
Okay, so I just need to clarify that I haven't done the contact tracing here at Barwon Health. I've actually been predominantly involved in metropolitan Melbourne, but working from home.
Yes.
So when the first wave came, I was on the hotline, but that sort of all settled fairly quickly with the numbers reducing pretty quickly, and so that job didn't really go anywhere. But then when the second wave came to Victoria, obviously there were significantly more cases, and I then became involved in the contact tracing, which is, I've really enjoyed it. It's sort of, you're still, using all your nursing skills to talk to these people over the phone and care for them in a different way over the phone, and try to get as much information as possible to then be able to develop information back to the Department of Health and Human Services to identify where they've been, where they got it from, and where they might have passed it on to. So it really loved that role as well. So it's coming slowly now to a bit of a halt, which is great for Victoria, but still a couple of ongoing roles in that area as well for me. So that's good.
Yeah, well, amazingly important area. So thank you for your role in that.
Yeah.
And Donna, tell us a bit about your background.
My background, I've only been in Geelong probably for the last 9 or 10 years. So my background in nursing started at the Royal Melbourne Hospital in the kidney transplant unit. Okay. I was there a clinical nurse specialist and really involved in the transplant team. We used to go over to Tassie and do a lot of education to the patients, because we would do the Tassie patients at the Royal Melbourne as well, and also worked for a time at the peritoneal dialysis teaching and education centre, where we would train people how to do it, set them up at home and follow them through and be a good point of resource and point of contact for them and their families there. Through Renal, I then dabbled in research in the renal field at the Western Hospital, and then not long after that I moved to Geelong. And it's really in Geelong that I started working more and more in cardiology, and then the research job came up here, and I've been here now for over 8 years in the Cardiology Research Unit.
Right, okay. And Susan, what about your background?
Well, I originally trained here in Geelong in 1984, and so that was a long time ago. And then I went and did some work in Sydney, and I worked in Melbourne, and I worked overseas, and then I came back here and I went back to uni, and then I went and did midwifery, and then I did some work in a nursing home for a while, and then eventually in about 1997 I came back to Barwon Health and started working in trials.
Right.
Since then, I've spent about 10 years in endocrinology, and then moved across to cardiology. And in the meantime, I did a graduate certificate in diabetes education as well, because that was something that interested me at the time.
Now, I noticed from your bio that you actually spent 20 years in the emergency department of the...
That's Anne.
I'm sorry, that's Anne. Anne, so 20
I've
years.
spent 20 years in trials.
Right, okay. So there's amazing medical experience amongst all of you, but Anne, that 20 years in the emergency, that seems like an extraordinarily long stint in what must be one of the most stressful areas of the hospital. What kept you in that for so long?
Oh, I loved it. I think you can either work in emergency or you can't, and if you can and you love it, that's the only place you want to be.
Yeah.
And I would never have thought I would have left that sort of work, except my children and my sort of social life got in the way of shift work, really. So I left shift work more than I left emergency. And I missed it for a long time. Absolutely loved it. Great place to work. Yeah, but I've been gone for a while now, so I feel like, this is my home now. So yeah.
So what year did you start in emergency? Can I ask that?
Start at uni.
What year did you start working in emergency?
Well, 92, 93 maybe.
So that's, I mean, obviously you would have seen a lot of missions of heart issues over that time.
Yeah.
Did you experience or note, much change in how these admissions were handled in the emergency period?
Definitely, absolutely. So, in 20 years of being there, we went through, the initial sort of thrombolysis and streptokinase, drug in the emergency department to dissolve that clot. And then, more recent times, but it's still been a little while now, straight to the cath lab for a hot angio to remove that clot immediately is obviously standard of care now to get them straight to the lab. So, but that was certainly not available back when I started in the emergency department. So yeah, all changes for the better. Barwon Health's got an amazing cardiology unit. It's fantastic. I think it's very well known around the country. There's excellent care for people who are experiencing cardiac problems, and pleased to be part of that.
And do you know, is there anything we can't do at this stage at University Hospital?
You're possibly asking the wrong person. I'm not sure. I mean, certainly, we do bypass grafts here now, whereas back 20 years ago, we didn't. So, we're doing a lot more in regards to what we actually don't do. I'm not sure. Sorry.
That's all right. Well, just tell Anne, while we've got you with the microphone, can you tell us what your work week looks like and a little bit about the clinical trials that you're involved in?
Sure. Yeah. So I work at the start of the week in this unit. I was 4 days a week. However, I'm 3 days now. COVID helped me lose a day, unfortunately, but I picked that up elsewhere as we've spoken about. So I run about maybe 5 different clinical trials at the moment. So you see people based on if you've got them booked in. So every clinical trial we run has a protocol that we follow the protocol, and so we bring patients in based on that protocol. So the visits might be weekly or monthly to start with, and then it might stretch out to 3 monthly or 6 monthly. So you see the patients and do whatever the protocol requires. So it might be an ECG, it might be blood tests. It's usually dispensing study medication and reviewing their health and if anything has happened to their health since the previous visit, and all of that stuff gets documented. And then we obviously do, if we take bloods, we've got to then process those bloods and centrifuge them and aliquot them and send them off with a courier off to the airport to send, to overseas usually. And then there's all the data entry into the system. So that the company gets all of that good information back, we then enter all the data in a timely manner so that everything's up to date. Yeah.
And how many people are participating in those particular trials at the moment?
So I've got one study that's got 18 people. Another study has got 13 people. A study that's just finished had 6. I've got about 3 about to start. So I'm in the process of just setting up those studies. So there's a lot of behind the scenes getting it all ready. So I don't have patients for those 3 yet, but they'll start coming. Gosh, have I got another one? That might be it. That'll do.
Okay.
Yeah.
Sorry, go on.
Well, one of our colleagues who's not sitting in here with us has a study that has about 50 people in it. So she's probably got the most amount of people in one study. So she's busy with that one study. So it has done amazingly well to get that number of people into her study.
It's quite amazing.
Yeah.
And Donna, what about your work week? And tell us a bit about your clinical trials.
Yeah, no worries. Well, I'm 7 days a fortnight here. And similar to Anne, I've got a handful of studies that I'm the primary coordinator for, and they range from cholesterol lowering studies using a medication that's not a statin, so it's good for people who can't tolerate statins, or they may be on the maximum dose but still, have trouble getting that cholesterol level down. Also, heart failure therapies, looking at medications to give our heart failure patients better outcomes. And also another study with patients straight after a decent sized heart attack looking at which medication may perhaps give them better long-term prognosis. Yeah, so my job, you know, the studies that are ongoing, we would manage the patients, get them in at their visit time points that they needed, and similar to Anne, when the patients come in, it depends on the protocol what's needed, bloods, ECGs, blood pressure. A big part of our job is really spending time with the patient, noting down any changes they've had, you know, have any issues, have any medications changed, and then try and work out why and what's going on with their health. And then studies that are ongoing as well. It's also about, you know, sifting through and trying to find more people to recruit. The more people we can recruit, the more successful the studies are. And, you know, it's a great thing for the participant as well, getting that extra monitoring here that they wouldn't otherwise get. And you really do develop a really lovely relationship with them because they continually come back at all their time points. So not only is it's sort of good for them, they're getting extra monitoring, but it's also lovely for us to really get to know them, and you really do form nice relationships with them.
I noticed your research involves improved treatments and better outcomes post a heart attack. And my father died at the age of 42 when I was a teenager, many years ago. And back then it was the strict instructions were to stay in bed and rest following a heart episode. But now, as we've seen at the fabulous Sunrise Centre, it's almost having a bypass one day and onto an exercise bike or a treadmill the next. Can you tell us the reasons for pushing a patient so hard after a heart surgery?
Oh, you know, look, I don't know that I'm the right person to ask for all that, you know, intense on the ward person, because we're not really there on the ward immediately post-op. But I think, you know, stats have shown us that you know, the longer you lay in bed and stay still, the more likely you are to have more complications, whether it be chest infections, clots, whatever. And our treatment's so good, it's actually found that you know, the sooner we can sit people up, get them moving gently, the quicker their recovery and the less likely they are to have more complications.
Yeah, okay.
Yeah.
Susan, so I think you've been involved in clinical trials right back to 1999. So what was your focus back then?
Diabetes trials and endocrinology related things, looking at bone density and bone density loss and that kind of stuff.
Okay. And why heart now, and what's your research focus?
Oh, well, was an area I didn't know a huge amount about, so I thought it was time I learned. So I moved over and jumped in the deep end. But
yeah,
most of my studies at the moment are looking at heart failure, which is, you know, it's a massive problem for people in our society at the moment.
Yeah. And what is it you most enjoy about your job?
Oh, I love seeing the patients. Yeah, I love following them through. You learn about their families. You know where they've been on holiday. It's a great job. Really, it's a great job.
Yeah. This is a question for any of you. Look, a few weeks ago, we had a chat with a couple who just enrolled, or they enrolled over the last 10 years, I think, in multiple clinical trials with Barwon Health. And their latest was the trial for a vaccine to fight off COVID. And it was just so impressive. In fact, the story was in the Geelong Advertiser. But I was so impressed at how brave these people are and so selfless. So why do people consider participating in clinical trials? What's the motivation?
I think a lot of them, for us, when you ring and approach people, if they've got a substantial medical history and spent quite a bit of time at Barwon Health, most people are so happy for the care they got and are so thankful that they've actually now got themselves, you know, in a reasonably good situation. They're really happy to give back. You know, that's one thing a lot of them do say is, oh, Barwon Health were great to me in my time, or great to my dad or my sister when they were in hospital. I'd actually really like to do this, to give back, you know, and be a part of it. And, you know, a lot of them do say that, you know, there is generally with most trials 50% chance that they might get a placebo. But they're like, you know, it doesn't really bother me if this particular medication is not going to help me right here, right now. But if I can be a part of that process to improve it for my children and my children's children, I'm happy to be a part of that. And it's really nice. It's we're incredibly grateful to all our participants for giving up their time, because it is entirely voluntary. And they may get placebo. So at best, they're getting the extra monitoring and all the extra testing that we provide. But other than that, there may not be anything for them right now that they will get from it. But they're wonderful.
Yeah. I guess for those who aren't on the placebo, they get access to medications that are not on the market. And as you said, the monitoring. How many trials has the Cardiology Research Unit been involved in over that 20-year period?
Oh, I think it was well over 200 trials we've been a part of over that time.
Right.
And trials can last, some might last 6 months, some might last 5 years. So they're all very different in their how long they go for and how often we bring people in for their visits.
Mm-hmm.
And at any one time, we've had, over 300 people here on various cardiology research trials.
Wow.
So it's really great.
And you're always on the look for more people to volunteer?
We are. We continually have studies that are wrapping up and then other ones that are about to take off. So, we're always, part of our job is always hunting for people and looking for people who may fit the criteria for the trial and are happy to give up their time to be a part of it.
And am I right in assuming the criteria would involve someone at risk for heart issues, or is it across the board?
Well, I think with any medication you take, there's always potential side effects. Even our Panadol, if you read the packet and the instructions, there's always potential side effects. And that's part of our job, is to look for any side effects and monitor. But as we know, the golden rule in research is your patient's health and well-being comes first. So, if we're finding that someone does suffer a particular side effect that we think is related to the study drug, we'll certainly deal with it and, potentially put them on what we call the drug holiday and stop it until we can get to the bottom of that particular effect. Yeah, but, that's why we monitor them, and that's why they have their visits, so we can be right on top of anything that may happen.
I think you were asking about are they at risk of heart attack? So I think probably more to the point that the people we bring into the study have got pre-existing cardiovascular disease. So they've had the heart attack, they've got the heart failure, they've got diabetes, they've got high blood pressure. So generally the cohort of people, unfortunately, they've already had their heart attack. Yeah. And then I guess ultimately for those people, it's all about reducing all their risks for the future. So, they've been declared as being at risk because they've already had an event, and their job and their GP and their cardiologist and our job is to reduce every other possible risk. So the things that you can reduce, stop smoking, start to exercise, eat better, lose weight, control your blood pressure. They're all things that you can control. And we pretty much promote that. So do everything you can that's within your power to change to improve your heart health. You obviously can't change your genes, but you can change everything else. So unfortunately, by the time we meet them, they've already declared themselves as having cardiovascular disease, and we
although it just depends on which particular trial we're looking at, because some trials are looking at perhaps people might just have a little bit of excess weight and they might have high blood pressure, and we're running a trial that might look at using a medication that we hope will reduce the risk of them going further through that and developing actual an ischemic heart event or something like that. So there are trials that are actually looking at people who don't or who haven't developed into acute cardiac events yet.
Yeah. I mentioned stereotypes earlier, and I guess when you look at the stereotypes of those involved in the construction industry, as those are our audience, the Winslow Constructors, there's probably changed a lot over the years. But I do recall when I was a student, I took a gap year over in Perth and took on a labourer's role over a 6-month period. And the work was tough and physically demanding. But back then, you'd be on a site around 6:30 in the morning, so you'd skip breakfast, and sometimes take takeaway snack on the drive in. Then smoko break around 10:30, and back then it really was a smoko break. Wash down with a sugary soft drink or two, and maybe a coffee scroll. and lunch would mean a few 4 and 20 pies and more soft drink or a chocolate milk. And then after work, it was down to the pub for a few smokes, a few more smokes and a few pots. Now, I'm sure that's not the norm for the Winslow folk right now. And thankfully, as a whole, society has turned against smoking, sugary soft drinks and poor food choices. But the best advice to the men and women of Winslow in achieving and maintaining a healthy heart is that all about exercise and dietary. Is there anything else that they should do?
Oh, I think they're the main ones, really.
Love
Yeah.
the life you're in.
Yeah, and I guess the other thing is, which I read a stat this morning in England, I think it was something like they've found another 22,000 deaths so far during COVID, not directly related to the virus. And a large percentage of those were heart issues, people avoiding hospitals and doctors and not getting treatment early enough. So, you know, I guess it's looking out for the signs and acting immediately.
That's right.
Yeah.
Yeah.
There's a very old phrase that time is muscle. So, you know, if you're having a heart attack, the longer you sit on it, the more muscle in your heart is at risk of dying. So, yeah, time is muscle. So if someone has got chest pain and it doesn't go away, they need to do something about that immediately.
Yeah. Now, I know time is right against us, but just finally, we had a wonderful announcement earlier this year that the incredible Costa family, who've just done so much over so many areas in our community, have made an incredible contribution to establish the Adrian Costa Clinical Trials Centre, where clinical trials over so many areas we all brought together under one roof. Just briefly, what does that mean to you?
Oh, look, I think it's fabulous for Geelong and for Barwon Health. I think it's great for more collaboration and cohesiveness with all the research groups within the hospital. And hopefully it'll lead to more research, which ultimately will lead to better outcomes for our locals and beyond.
What building are you in at the moment?
Sorry?
Which building are you in at the moment? Where are you working from?
We're at Myers House on the corner of Myers and Ballerine Street.
Right.
Yeah.
It's an old building, been around for a long time.
Okay, well, you might get a nice refurbished building in the...
It will be very excited if we do. We think it's great for research and great for Geelong. We're very grateful.
Yes.
Well, look, thanks so much, Donna, Anne and Susan. I really, really appreciate your coming along and sort of having a chat today. It was very brief, but I know you've got such a busy day, busy schedule. So thanks again for joining us.
Thank you for having us.
That's great. In upcoming Winslow Health webinars, we've got one more. We've had cancer, mental health today, cardiology. Next week, we've got a webinar on general health with Dr. Rudy Gasser. Right. So thanks again, really appreciate it. Thanks, Winslow, and thanks for everyone tuning in. We hope to see you all again next week.
Thank you.
Bye.
Bye.